Yeah, hello and welcome to another video here on my channel. On my channel, we have the focus of craniocervical instability, but also we take care about neck pain and all the issues here in the upper cervical part of the body. And today I have Brian again here on my channel. We had already a couple of videos because he is really one of the experts globally on the neck curve correction and on the getting the right structure here in the neck. And I'm very emotional today because we want to announce a new project of Brian, a artificial intelligence which supports you to become a better posture and to work on your mental health. And Brian, I'm very fascinated already. You showed me already a little bit of your software and your approach. And I mean, today we want to dive a little bit into the software to show you the software, but of course also to give you some more background information. So Brian, I'm very happy to have you here again.
Thank you, Uli. I'm happy to be here with you.
Yeah. Brian, not everybody has seen our last videos, so let's dive a little bit into the importance of the neck curve and what happens if the curve is out of the range.
Sure, that's a great place to start. So, spinal curvature is really imperative for long-term structural health. Now, there's always outliers, Uli. For example, somebody that we all know may have smoked 2 packs of cigarettes a day, have terrible posture, be 90 years old, and be vibrant and healthy and still have their mind to them. But that's the outlier. If we want to try to do what the statistics show, give us the best chance at expressing health into old age and maintaining our health at a very high level, we should really consider having a good spinal curvature. A really good example that just came into my office yesterday is a lady that I've had the privilege of helping for over the last 5 years. She first came into our office with terrible, debilitating mid back pain. And we assessed her, and this was when I was working with another medical doctor. And we decided that we really needed to get some imaging before we administered any treatment. And she had had a compression fracture of her T8 vertebra. So in her thoracic spine, it had experienced a compression fracture. She had a terrible kyphosis in this area, and it's very likely that the compression fracture was due to abnormal spinal curvature and osteoporosis, or kind of what happens a lot of times as we get older, where the bones get a little more brittle and weak and not as dense. Now, let's fast forward a few years. We correctly found that compression fracture for her. She had a medical procedure done where they support the strength of that bone by injecting a certain material into the vertebra. And then we managed her for some of the residual pain. I was able to help her become pain free, back to moving, expressing health at the highest level. But she had still these very pronounced abnormal spinal curves. And now, just recently, she experienced a prolapse in the bladder and pelvic region where the organs actually descended downward, causing extreme pain. She's now scheduled to get a surgery where they kind of raise up those organs as well. And during the process of her going through and meeting with all of these brilliant doctors that are going to help her with that surgery, she came to the conclusion, I didn't even have to tell her, that it increased the probability of this prolapse happening because of how bad her spinal curvature was. So this is an extreme example that I'm not saying that someone with bad curves is always going to have prolapse, but the chance was increased because her curvature was so bad in pulling her body downward that it was also causing her organs to be pulled down. And over decades and decades, led to the increased chance of what she's going through now. So, spinal curvature is imperative for structural health. If you are conscious of what you put in your body, if you're conscious of the thoughts that enter your mind, then a third very close component that's equally as important would be maintaining a good structural form and integrity, because it's the housing, Uli, that allows all of the electrical and plumbing in your body, the nerves and the blood vessels, to flow unimpeded without interference.
Right. I mean, for me, it's also clear because the organs, some were fixed. and they are fixed at the spine. So if the spine has the wrong curve, the organ's also not on the right place and cannot really work like they supposed to work. And then you have problems with the digestion and so on.
Uli,
But coming a little bit more to the up, I mean, of course, target group is neck pain, yeah, but you're also focusing a lot of instability. Instability is not so known, but if a vertebra is moving too much, then this is also causing pain. At the end is also pain, but also, and this might be even not so much known, a lot of neurological problems like heart rate problems, like breathing problems, like anxieties, like attacks, anxiety attacks, and so on. So this is all connected to the vertebra. Why is this so much connected?
well, your spinal cord can only stretch up to about 10% before it undergoes tension that causes symptoms. And when you have a good natural spinal curvature, it allows your spinal cord to sit right in the place it's supposed to be without any stretch on it. When we start to lose our spinal curvature, it creates stretch on the spinal cord. It can alter the cerebral spinal fluid flow, which is the very important fluid that sits right on the outside of our spinal cord and surrounds our brain. It acts as a shock absorber and it acts to do so much more to keep our body healthy. And when that flow gets impeded, it can contribute to a wide array of neurologic symptoms. So, tracing back for a moment, I want people to understand that very often, if you have a neck condition, a neck problem, you have anxiety, you're getting tachycardia, you have blurred vision, you have brain fog, you have difficulty holding your head up, you get pulsing in your neck, you have really bad distraction and concentration problems, and you just feel like something's not right, that you really need to give some consideration for your entire structure. I see it time and time again that people have some kind of a condition where they do have a neck problem, but they're told by other doctors that the only thing they have to do is only treat the neck. And sometimes it may be the case, but it's much more often that you need to make sure your entire body, your entire system is working well together. I always make a metaphor that if you had a symphony of 200 individuals playing instruments and the sound wasn't right, and the only person that you were trying to correct was the conductor in the front. So, the atlas may be the conductor and the cervical cranial junction may be the conductor, but you still have to make sure everything else is in tune and that it's all working in harmony. That's where the software, which we'll introduce soon, will come into play to make sure that people are considering their entire skeletal structure. But you can continue with the next question as well.
It's like, I mean, before we start with the software, I wanted to mention you develop a very special method, and you're probably only one of the few doctors globally who really take care of the structure of the craniocervical area. So you developed a method how to correct the curve. So patients come to your praxis in Florida, and then you check the curve, you make an X-ray picture, yeah, and based on that, you place weights. And I did this, and we did a video on that, so I can only recommend, and I will link the videos that we already did also here in the description of this video, so you should have a look on it. So it's a very unique method, but of course not everybody can come to you, and that was the starting point for you to develop the software. But before we jump into the software, please, can you briefly explain your method a little bit more in detail?
Where do I start? So it's been probably about 10 years now of since I first purchased a digital motion X-ray machine in July of 2015. So in July of 2015, I traveled down. I was living in South Carolina. I traveled down to Florida, purchased a digital motion X-ray unit, and drove it back to South Carolina and started to learn how spinal curvature really could change. Let me actually, if I will, let me restart the answer to this question. So, because it's a hard one, it can be very long, but I want to try to make it concise for the viewers. My interest in spinal curvature began when I was just a young kid, and it started because my brother developed a debilitating scoliosis, Uli, that eventually was going to compress his heart and cause him to not be alive anymore. So it was a fatal curvature. So his curve changed so much that it was compressing his heart and his internal organs, and he had to do a pretty emergent spinal fusion. They were tracing it over time, and they noticed his curve was 30 degrees, then it was 50, then it was 70, but he had to pretty quickly get into a full spinal fusion that saved his life. So I didn't think too much of it then that that was going to be my calling because I was only maybe 10 or 12 when we were going through this, and then even a little older. I think that's too long. Let me do it again. We can cut to this.
No, it's perfect, Brian, because it shows the motivation of you. Yeah. And I have seen the story because I'm watching you also on your YouTube channel, and I also can recommend your YouTube channel.
Thank you.
And that was the starting point. But more or less, coming to the method is like you're using weights where you put weights on the forehead, on the
Yes.
neck, in different directions, and then you do exercises in the standing. So that's the way why you call it standing weights, because you also need to have the balance and the muscles working together when you do the
Correct.
exercise. And that's differentiating your method, so,
Yeah.
in my words, to the more passive ways that a lot of
Yes.
other doctors do it, which is also relevant in some cases, not in all cases, where you just lay down and then they have some piece which is like shaping your curve in a
Yes.
lying position. So, and that I think for me it's the big difference of your method, this
Correct.
active way with the muscle tension and the balance and also the muscle training. And yeah, this is the standing weights method. Yeah,
So, a way that I kind of see an analogy getting put in place here is it's pretty well established that people that are having some proprioceptive problems or even developmental delays, that there's a therapeutic benefit to horseback riding. I'm not sure if you've seen that before, but they'll
no,
put either adolescents or children that are having a little bit of a more challenging time developing, or even people that have some kind of a slight balance problem, they'll put them on therapeutic horses that just walk with them. They're not really running and tons of force. And that kind of active stabilization that their body has to encounter while the horse is moving is extremely helpful to, for their neurology. There's been several, studies that have shown that. And
mm,
so the reason that it works is because you're upright and your body has to, in real time, adjust for the inputs that are occurring. So that kind of a mindset is what has led me, also being an athlete my whole life, to understand the importance of something that challenges you while you're in a weight-bearing position. You have to be able to get full rehabilitation, you have to be able to tolerate the forces while you're upright, while you're moving so that you can return to a normal function. If you lay down and you're passive and you're just at rest, those changes from laying on a device like a Denerol or something that creates a cervical curve in that position is not going to be as long standing of a change. For certain individuals, if they're extremely tight, they have zero hypermobility or instability, just a passive device like a Denerol may provide value because it is going to elongate and stretch tissue into a better position. But for anybody that has any form of hypermobility, connective tissue injury, whether it's just some tendinopathy or if it's a combination of tendon injuries and ligament injuries, it's going to be much more valuable if you can figure out the perfect individualized plan for you that allows you to control your body while you're moving, being upright, sitting, standing, and moving. Working with Dr. Dennis Wogan, who has just last year, he passed away, was the first chiropractor that turned me on to standing weights. He had been using digital motion x-ray and standing weights for decades, and he was really, in many ways, my mentor as to getting me involved in starting to find better ways to improve spinal curvature. And the first one that really showed me how important that it could be.
sure. Yeah, and also I need to add that that because in the standing weights you can solve one problem if you have a forward head posture. The neck is normally too far forward, also the lower part of the neck, and then if you're laying on a Dana roll device, it's pushing even farther
Yep,
forward,
more
and
forward.
your weight's pulling this part of the neck backwards and the middle forward, so that the curve is really on the right place.
Correct.
So having said this, so you've been working already a couple of months on your AI solution, and already now we have now one module which is available. It's called the PostureVision. So it's super, yeah, it's supervisioning you if you want, yeah, and correcting your posture. And yeah, let us have a little bit of you inside the software and their capabilities.
Okay, so I actually, surprisingly, this stuff is kind of hard to figure out. Um, Uli, so fast forwarding to why Posture Vision has been created and where it is now is as I started to work on these really hard neck cases, and many of them have great success, and no doctor can help everybody. I've had probably 5 or 10% of the people that come to see me, I'm not able to help them, and I try everything in my power, and I do my best and they don't get better. And, so then maybe they need a regenerative medicine doctor, or maybe they need some work done with their jaw, or maybe they need a spinal fusion. So, or maybe they need a jugular vein stent put in. So, no practitioner has a 100% success rate. But I've had some pretty difficult cases that we've witnessed miraculous healing. And so from that, I started to get some people reaching out from other places, other countries, and many people will travel from other countries to come to see me. But those that can't, I said, how can we still find a way to help people all over the world that don't have access to this unique kind of care of focusing on the alignment, the curvature, and the stability to really restore structural health? It led me to take on a select amount of clients where I was helping coach them on their posture and then also guide them to ask the right questions to their local providers, to encourage them to seek certain care. Of course, if their primary care doctors also agreed, but just to kind of cue them on what to ask. And when many times they would go in and say, there's something wrong with my neck, and they would get dismissed as if, the doctor didn't believe them. So then, from doing the coaching program, again, there were certain individuals that returned to work when they were bedridden. There were certain individuals that their dizziness went away. There were certain individuals that noticed their postural changes, and all of their friends and coworkers were like, "What happened to you? You look different. You look better." And so from that, I realized that there's a unique opportunity in 2025 with all of the advances in technology and AI and machine learning and the things that computers can do now, that we could code everything that was inside of my brain, all the knowledge and wisdom, into a computer software and create access to this kind of information to everyone on the planet. And that idea was really exciting to me because being in office, I'm only limited to 5 patients a day. I take an hour and a half with each patient. And I was like, how can we get this information out to everyone? And so that led to the development of Posture Vision, which has now been in process and in development for approximately 17 months, so almost a year and a half. It's really hard to build this, but we're making a lot of progress and it's ready to be used now.
Super.
So, Posture Vision initially is built for remote workers and gamers. So, anybody that's on their laptop, their desktop, on their device for long periods of time, you can turn on Posture Vision and use it for active understanding of what your body's doing. You can minimize it and it'll run in the background. And when you're done with your work, you can check on how you did during that session. It'll give you insight into how many times that your head was forward, how focused you were. There's kind of a sweet spot between being too hyper focused and never looking away from the screen and not blinking enough, meaning your body's kind of stuck in a sympathetic overdrive, which isn't good for your nervous system long term, and being too distracted and always looking away. So we've built in some logic to help you determine where do you stand with that. Within the coming weeks, we'll have an input where you can talk to the voice AI agent, share with it what you ate that day, what stresses are in your life that day, what your calendar is like. You can connect your calendar, and then it will help you to know that during this segment, Uli, between 9 and 12 today, You maintained really good posture. You had a gentle, relaxed focus. Your emotional state seemed positive or neutral. But then between 3 to 4 p.m., we noticed you were losing concentration. You seemed more irritable and fidgety. Your eyes were blinking much more. You didn't seem as happy. And then it can correlate what was happening around that time. And also, was your posture changing during that time? Is it primarily a structural issue with your posture, or is it just that meeting and stressful event that you had to go through? And then start to provide meaningful insight into how you can make corrections to your posture, to your habits, to your lifestyle to help support a healthier you and prevent people from ending up with one of these ticking time bomb disorders where many people say, I was fine yesterday, and then I woke up today, and now I feel dizzy and lightheaded, and nobody can get it better. So, very often, these problems are developing for many years before they actually become symptomatic. Just like when you go to the dentist, you don't always have pain in your mouth, but they can tell you have a cavity. So we're
Mm.
trying to be that early detection and also correction where people can maintain their health even with using technology all day long. In
Interesting.
quarter 1, maybe by the end of quarter 1 of 2026, we plan to integrate also x-rays. We're working on how that looks, where you can not only have the software watching you in real time, taking calibration photos from the front, from the side, and from the other side, and helping you to detect micro changes and give you meaningful suggestions for exercises and movements. But you'll also be able to input x-rays of you in the standing position so it can become even more individualized and detailed with the suggestions that it makes for you based on a decade of experience of knowing that if somebody presents like this physically and their images look like this, that it's most probable that these things are going to work for them and these things may be more challenging or more difficult. So that should be released as well by probably by the end of the first quarter of 2026.
Okay. So, and do I understand it right? So there will be also two versions of this new functionality with the X-rays. So one, you book by yourself, you get access to the software, you upload your images, and then the software, the artificial intelligence tells you a little bit about your curve and proposes you some measures to correct it. But there will also be a kind of version which helps doctors to have real patience to work on their curve, right?
Yes, we intend to have an enterprise version. We intend to have a version for other doctors, physical therapists, personal trainers to use so that they can also monitor their clients and patients in between encounters or visits. So, one of the big problems with healthcare right now, especially with physical therapy, chiropractic care, osteopathy, medical doctors that work on functional medicine or pain management is that when the patient leaves the office, they have very little understanding of what they're doing. And so, with this kind of a software, we'll be able to bridge that gap and provide meaningful insights so that by the time that you show up at your provider's office again, they'll already have pulled up exactly what you've done. During the time that you allow the software to monitor you, none of the live video is going to be recorded or saved. We take the data points and only select photos when you allow permission for this snapshot. So there will be
Okay.
snapshots taken. It's going to be
And that will
compliant
be
with GDP.
communicated to the doctor, right? Your doctor can then analyze the development, your posture during the days, during the months, getting
Yes.
improvements, and doing readjustments of the training.
And the doctor can recommend specific exercises, which can then be monitored by the AI in real time to make sure that you did them at the frequency, at the duration, and with the right movement that you were taught. So we'll be able to have it set up so that the doctor can recommend this is your exact exercise, Uli, and they'll have a setup with cameras where they can show you it in office. Like, I want you to do this motion 10 times a day. And so then it will watch you, it'll save that video of how you should do it, and then it'll make sure you're doing it correctly or give you little arrows or guide you. Because very often people get homework that's good for them. They go home, they do it wrong, and then they say, it hurts, I'm worse. And really, there's no way to determine did the individual do the homework wrong, or was the prescription wrong? And so now this will bridge that gap to be able to show that the person is doing exactly what they were asked to do, and it'll help improve outcomes for patient and client care.
So it's not only supervisioning your daily work, how you act and how you move and how you blink. It's also checking whether you do your exercises right that have been described by your doctor, right?
Yes, isn't that
And it,
brilliant?
and
Yes.
it tracks if you do it right.
Exactly. If you do it and if you did it correctly. So, we get a lot of people in this kind of a physical medicine or physical healthcare place that when they're at the doctor's office, doctor does good things, the patient feels a little better, they go home and they don't do anything they're supposed to do. And it's not really the individual's fault. It's because the follow-up systems are inadequate. And so we're going to be the solution to that follow-up system. Even successful entrepreneurs, there's a guy that many people may know, Gary Vaynerchuk. He has a lot of publicity and he has these marketing companies. He was on stage at a symposium saying that the follow-up care, he never does it. And this is somebody that's a high functioning person. Nobody, very few people do their follow-up care. So this should bridge that gap, make it much easier to monitor, and improve outcomes across the board for structural healthcare. So we're really excited about that.
Brian, I mean, we discussed this already in the last video. I did the curve correction with you. I did the remote curve correction, so I was never visiting you, but you were checking the pictures, and we did the consultation here on the video.
Yes.
And I did it really very strict every second hour over 4 months. But you need to be your mindset needs to be very, very precise that you say in every meeting, I need to step out briefly, I do an exercise, I come in again, or you leave the office and you go to a meeting room and do your exercises. You always have the weights with you. You need to be very, very, yeah, a strong mindset. At
Yes.
the end, Brian, I'm now 3 centimeter taller
That,
because of my head,
yeah.
my posture correction. We detected for starting from here, I'm 3 centimeter taller. So that the impact was phenomenal. Yeah.
Yes.
But what I see, many people who do the curve correction, they don't have, they are not so strict. So they do it maybe 3 weeks and then it's losing focus. It's losing focus. And I think this tool will at least increase
Yes.
the
Well, it'll
focus because
increase.
you need to do it that it's recorded and you did it.
It'll help improve outcomes, and then we can more accurately predict precisely what kind of a person is going to be a responder to what type of care. So if, for example, Uli, you have a lot of good traits, okay? So you're very diligent, you're very in tune with subtlety. So when you were taught how to wear the weights, you did it correctly, and you really made sure you were standing correctly, you're focused, and then you went and you completed the exercise as you're asked to do. Some people just have more of a distracted mind. They keep thinking about something else. They just put them on and they start thinking about something else. They forget to do it. And so in your case, you've proven that we can improve our posture in a very meaningful way that improves our health without having to go into an office, which is amazing. But we're trying to find a way with the software to make it so that it's reproducible across, the entire population.
Sure.
So,
Yeah. So,
yeah, good. I'm
Brian, I
really
think
happy to
now it's the
hear.
time to flip a little bit and share your screen.
Shall I show where we are now? Okay.
Yeah,
So with PostureVision, which is the name of the software, it's going to rapidly change. I mean, it's going to be improving quickly. Every week, the software will look different. So here's an example of where we are in this very moment. But I will tell you, it's going to change very quickly. Okay, right? So we have here, I'll have to turn off my camera here. Okay, so let's say that we've logged in, we're here and using PostureVision. So this is a one just for us to test, but it's really, the website is posture.vision. So you won't use the staging, it'll just be posture.vision. When you create an account in the top, as you first get the opportunity to go to the main page, it'll explain a little bit about what we do. You can click on sign up. first and go through there. We already support German, so you can already have it, changed into your language, which it should. If it doesn't show up here, it will show up within the next day. So give me just a bit with that. But as you go ahead and sign in, once we sign in, we can do a calibration, which this was something that I showed you, Uli, but I'll take everyone through it again. So the first thing that it will ask you to do is to calibrate your posture.
Welcome to PostureVision. Let's set up your posture monitoring system.
And then you'll sit in an
Perfect. Let's start with your front view posture analysis. Please face the camera directly and sit naturally.
Good. So we'll start with the front view photo, and you want to be in a natural
Excellent front view
posture.
analysis complete. Now let's capture your left side profile for spinal
Then
alignment.
the left side.
Great left side analysis finished. Now let's get your right side profile to complete the assessment.
And the right side.
Fantastic. All posture photos captured and analyzed successfully. Now let's set your primary health and posture goal.
Okay, then you'll get to choose, and this will evolve over time as well. Right now, if you're just maintaining good posture, you don't really have any problems, you get a little bit tight or have aches and pains, or if you have some pretty serious health conditions going on. And then based on how you select it is how the software will communicate with you. So if you're
Okay.
suffering with a lot of chronic conditions, it's going to be much more gentle. It's going to give less suggestions. It's going to be more of a monitoring system. And then just maybe over time, gently guide you with subtle things, but it may ask you to first get permission or some kind of a waiver from your practitioner that says it's okay for you to use it. If you're feeling pretty well overall, it may challenge you a bit more and give you more exercise and things to do. Then when you complete the calibration, now you'll be able to go on your dashboard, which is on the left side, and you'll get to check out your calibration results. So this is included in the freemium version. The session analysis will be a paid premium feature. It's only $8 a month investment. And anyone that signs up now will get the opportunity to help us build the software because I will be individually calling every single person in the first 250 people that use the software and asking them how that we can make it better for them. So as you
Okay.
can see here, it took those 3 photos that I just had taken and it gave me a quality analysis, which lets us know how well the photos were taken, if the lighting was correct, the positioning was correct, so that there's an accuracy. Then it gives me scores of my posture based on a few different factors like my craniovertebral angle, my chin angle, my head angle, to know, really what kind of a posture do I have to start? And you'll be able to see more information over time about what things were good and what things could be improved. My shoulders were 1.2 degrees from horizontal, so it looks like my right shoulder is a little bit lower than the left. So it didn't give me a perfect score for this one. But so there's some things for me to work on as well. And I do notice that my left shoulder has a tendency to hike up just a hair. So that's something I'm still resolving and working on to keep myself well above ever returning into a state of having symptoms.
Okay.
Because when you reclaim your health, it's not promised that you'll keep it. You have to, maintain it.
It's a
So,
work. It's a permanent work.
yes, it is. It is.
But
People,
Brian, the left and right score um, of your pictures
yeah,
indicated only a score of 80%, right?
yes. And
Posture
so
score. Um, so what's up here?
we're still refining the logic. The more data that we have, the better that the scoring will get. At this
Yeah.
time, we're never going to intend to treat, diagnose any condition or disease. But however, we do want to give people really, really incredible insight into their structural health. So this scoring is built on probably about 10,000 lines of logic that we've coded into the system. And over time, I anticipate that that'll be, much more. So there's so many different components that we're going to be measuring as far as, if this, then that. So hold on, I'm not able to turn this camera on. Let me show you something. So over
Yeah,
time, this will become even more sophisticated and it'll explain to you the
right.
reason why your posture score isn't perfect, and it'll show you exactly what you can do to make it better.
Okay.
And that's going to come
Okay.
up within the next couple of weeks.
Okay.
It'll keep getting better and better. So now that we've done a calibration, we can start a live session. So as I start a live session, if my camera is really far away from myself, I can zoom in a little bit. But if I have a normal laptop camera in front of me, I can be here. It shows me my shoulders are pretty balanced. If I bring my shoulder up, it'll tell me it's off right here, and there'll be an arrow to tell me to bring it down. If I bring my head forward and I start getting too focused, the arrows are going to tell me to come back. It'll say head forward over here. We're working on building a custom emotion model, but we have a generic one in place here. So if I'm happy or if I'm frustrated or sad, the head tilt, it'll let you know if it's moderate, mild, or severe. It'll bring you back to neutral. How often you blink, how often you're yawning, if you're tired. Then let's say that, we want to get some work done, right? So we're not just going to sit here and look at ourselves all day. That's kind of crazy. So then we can click on the picture in picture box. We can, minimize it, get it out of the way, and this will be even more intuitive in the future. And then we can go ahead and check something out, Uli. So we can type in like top world news today. When are the wars going to end? And so, we can type something in and we can go browsing and see what's happening and uh, something like that. And then still here, this will be better. These four icons, this one is a postural deviation icon. This one is for hyperfocus. This one is if you're distracted or you've lost concentration. And this one is a drowsiness detection. So these will adaptively, we'll have our custom icons here soon instead of these template emojis, and they will change depending on your habits. So if over a period of 3 minutes, I haven't looked away from the screen, the hyper focus one is going to start to blink like, that you're too focused. So you'll know like, whoa, like look at something at different depth so I don't strain my eyes and feel bad later. Or
Okay.
if you're really tired and you're yawning and you can't hold good posture, then just like in some of the cars, when you're kind of swerving a little, they'll have the steering wheel will vibrate and you'll get a little sign on your dashboard that says take a break, and there's a little coffee cup. I know on the Mercedes they have that. And so right here, the drowsiness detection will also alert you like, hey, you either need to take a quick nap, you need to go outside and go for a walk, or you need maybe like a cup of tea or something. So it's going to help you to really monitor your health. So now let's say that we're done, it's been an hour. We're done using the software. You also can just have this out of the way too. You can have the software running and you can go do something else like this, and it's still running in the background. You don't need to see
Right.
it. So now let's say we're 3 minutes in, we're done. We're done using this. We're going to get out of here. So we can stop the
But
session.
it's also supposed to beep if I'm too long in so some kind of noise signal
Yes.
that I can turn on.
There's going to be initially three different components to how you can use it. One of them is active correction. And active correction, what will happen is as soon as you deviate for more than 3 seconds, there will be a voice AI agent that tells you, like, correct your posture or your left shoulder is down, and also on-screen prompts. And then you can have a moderate session where only if you've deviated significantly or for 10 or 15 seconds will it correct you, just in case you want to pet the dog or you want to scratch your leg, that it's not going to immediately bother you. And then there will be a passive monitoring system that it won't distract you at all. So you can get deep work done, but it'll notify you at the end of the session with something like this base version of our postural heat map. It shows my right shoulder was up for 7 seconds. It shows my head was down for 47 seconds. It shows my head was back for 12 seconds and that my head was forward for a minute and a half. So it shows you exactly how long those deviations were, if they were short, brief, or if they were sustained. And then we're going to continue to add in more details, which these are still, they're working. but we're going to make the logic that determines the score constantly better. And then corrective actions under the exercise plan will be coming soon. So based on your profile, it's going to find the most probable movements or routines that will help you to have better posture and spinal curvature. From that, you'll be able to also talk to the voice AI agent about, okay, so whenever I do this exercise, I do feel a little bit better. Whenever I do this exercise, I it hurts me here. And then it'll find ways around that. It'll give, when it hits a plateau that the software can't go beyond, it'll store that data and give you a PDF or a printout you can bring to your provider. I had this problem, I tried this and I just can't get this to work. So they already know what you've done. They have information on, what to go off of.
Wow.
Yeah.
I think it's very comprehensive and I think also very holistic. Yeah. With different views, possibility that the doctor is checking your data. But again, to stress this again, the basic version right now is free of cost. So you can do your
Correct.
analysis, right, of your posture. You can let it run,
Yes.
and get some basic ideas for free.
Yes, you can get basic ideas for free. Please use it. Sign up now. The first 250 people that sign up, if you allow me to, I will individually call you and email you and ask you, what can I do to make this better for you? We want this to
Mm.
be so easy to use. We want people to love it. And really, if you can get a perfect postural assessment and little insight into your daily routine as to how to be healthier for either a freemium version or $8 a month, I think that the value is really, really strong.
The premium version, what added value brings to the premium version?
The premium version will have the advanced analytics and also will suggest actual kind of interventions or movements or exercises that you can do.
Okay, okay,
But in the
all
freemium,
right.
you can do the calibration and you can watch on live when you deviate into bad positions. And then you can recalibrate over time to see if you're still making progress. So there still will be tremendous value in the freemium, but the amount of data that we have to use is high when we start to recommend exercises, have advanced analytics, and the cost of these cloud servers is huge. So we aren't able to offer the advanced things for free, or
No, no, that's
we
clear.
would go
I
out of
mean,
business.
I mean, we are in contact for a couple of months, and I know how many times you've been flying to the developer,
Yeah.
and I mean, you're extremely fast. I mean, the total AI world is now only starting to develop. We have a lot of possibilities, but I think you're ahead, yeah, from your application, and this is a very relevant application for a lot of people, yeah. And I mean, we already give also a little bit of an outlook of what's coming up next with this imaging analytics, which I also would love to share and distribute here on my channel, because this is another very, very exciting step for a more, let's say, cost-sensitive approach for curve correction. Yeah. Um, and so you have something for everybody. Everybody can afford a curve correction very soon.
Yes.
So if you want to go to a doctor, yeah, have it really 100% optimized, you can do it. Yeah. If you don't have the money to really invest a full package of curve corrections over, let's say, 6 to 9 to 12 months or even longer, maybe sometimes, yeah, you can do it here with the software. Yeah. And this is really a great opportunity, not only for my community for craniocervical instability, but also for all neck patients and also for all not patients, yeah, for all young people who are standing and looking 5 hours per day at the cell phone and already start to have a forward head posture. I think this is something preventative that everybody needs to do regular, because otherwise we get a huge problem in the society very soon, very soon. And
Yes.
Brian, I'm very thankful that you go this way, yeah, and work on this also to bring in your knowledge into the artificial intelligence as a starting point. And of course, I will learn and improve further, yeah. But this is really an excellent starting point. I'm very thankful for it, and I will promote it. Yeah, not only here on this channel. In my office, it will be kind of voluntary mandatory
Yeah.
for everybody, um, because it's so important.
Thank you so much, Uli. And I just to highlight, when we do get to the X-ray analysis, it will be integrated in as a branch of PostureVision where you can put in your photos, your X-rays, and there will be certain types of X-rays that it'll allow. It'll have to be standing and weight bearing and matching certain criteria. But with that, the analytics are just going to get more advanced over time. The value for individuals, I think, will just constantly get better. So please join now and help us to build it better. Remember, we need those first 250 people to help us make it better. So you can be the one that tells us, I need this put into it, or this was a problem, and we'll constantly refine it in real time for you. I think you'll be really
Sure.
happy.
One
Uli,
thing you need to show us, I will also link, yeah, the link to the tool in the description, but maybe you also show it how you where you can go to the tool. I think it's on your website, right?
yes. Yes,
If
you
you
can
can
find
share
it from
again and
Dr.
show a little
Hutcheson.
bit,
You
yeah,
can
where
you
it
can
is.
you can find it from drhutcheson.com, or you can just go to posture.vision, and the website is immediately there. You can sign up for free, start trying it. If you find the value and you want the advanced analytics, it's $8 a month investment, and we're really, really excited to share this with you. Uli, the way that I see it for the software is that we have the chance to create a change in how humans interact with technology. Essentially, I did write this down, but we turn every screen into a mirror for self-awareness and alignment, helping people feel, think, and perform better through subtle insights into their posture, their energy, their focus, and their emotion. So the product will set the tone for how we interact with our health through technology. And we're really excited to be able to introduce this to the public. Please join us. And, we're just so excited for the future.
Brian, again, thank you very much for your time today. Thank you very much for your effort. Yeah. Um, of course, you are not doing this for free, but as we have seen from your history, you're doing it also for passion. Yeah. So,
100%.
and that's the crucial thing, and that's the game changer. Yeah.
100%.
And I'm looking forward, yeah, to also be part of that community. And yeah, we can change something with the technology that it's now available with the artificial intelligence. Yes. Thank you.
You're welcome. Yeah, our goal is just to maintain just enough profitability so the company never fails and it can constantly get better. If we can make a net profit of $1 a month per person, that's enough because it's just enough to keep us going. But the costs of cloud computing and all these things, they're very expensive, and we constantly optimize the software to use the least amount of data that we possibly can, which also reduces electricity. And we know all of these things are important, but it is still an expensive endeavor to
Yeah.
undertake. So thank you.
So see you soon, Brian. Thank you very
All
much.
right. See you soon, Uli. Thank you so much. Okay.
So it took longer than expected, Brian, but it's always like this.